హలో యాస్ ఫ్రెండ్స్, వెల్కమ్ టు ఫార్మా సిండ్రోమ్ యూట్యూబ్ ఛానల్. సో ఈ షార్ట్ వీడియోలో మనం డోపమైన్ గురించి డిస్కస్ చేద్దాము. సో డోపమైన్ యాజ్ ఎ న్యూరో ట్రాన్స్మిటర్. సో డోపమైన్ యాజ్ ఎ న్యూరో ట్రాన్స్మిటర్ ఇన్ బోత్ సెంట్రల్ నర్వస్ సిస్టమ్ అండ్ పెరిఫెరల్ నర్వస్ సిస్టమ్. అండ్ dopamine in the peripheral nervous system having action on heart increase force of contraction and helps in the treatment of congestive heart failure. And as a diuretic, dopamine increase glomerular filtration rate and also used as a drug in congestive heart failure. And dopamine on GIT increases gastric movements. And in the central nervous system, dopamine having huge role. It can regulate our behavior, our emotions, our learning and memory, as well as it can regulate our addiction also. Especially dopamine is known as pleasure hormone, and dopamine is responsible for our addiction. In the brain there is a one area known as nucleus accumbens, that is addiction center. The nucleus accumbens is full of dopamine, and dopamine in the body binds to dopamine receptors. There are 5 types of dopamine receptors: 1, 2, 3, 4, 5. Type 1 and 5 dopamine receptors are excitatory, increase cyclic KMP levels. And type 2, 3, 4 dopamine receptors are inhibitory, decrease cyclic KMP. And all 5 types of dopamine receptors are belongs to G protein coupled receptors. And increasing and decreasing dopamine in the body responsible for many disorders, especially increasing dopamine in the brain may develop schizophrenia, psychosis. That's why anti-dopamine drugs like antipsychotics are the drugs block the dopamine receptors in the central nervous system in some locations for helps in the treatment of psychosis or schizophrenia as a antipsychotic drugs. And a decreasing dopamine may develop a movement neurodegenerative, especially neurodegenerative disorder Parkinsonism. Parkinsonism characterized by decrease in body movements. So our body movements are regulated under dopamine. That's why decrease in dopamine levels in the nigrostriatal pathway of brain develop Parkinsonism. And drugs like ropinirole, pergolide, pramipixole are dopamine receptor agonist, helps in the treatment of Parkinsonism. So dopamine receptor agonist helps in the treatment of Parkinsonism, and MAO-B inhibitors helps in the treatment of Parkinsonism. And antipsychotics, nothing but dopamine receptor antagonist, helps in the treatment of psychosis. So this is simply information regarding the this is information regarding dopamine. Okay, subscribe to Pharma Syndrome YouTube channel. All the best.